community to another. And websites are also considered as tools, but not as a mirror that would reflect the picture of the local community. For example, the images and the language was not inclusive. Those who were fighting for integration of gender didn't include that aspect in the work. So I would like each of you to take 10 minutes in turn to share your experience with us on these three topics. The first one is the capacity to discuss and coordinate your perception of inclusiveness and participative measures in your respective areas. The second topic is to say how the outbreak of COVID-19 has impacted the inclusion in your communities. And what type of new multiple exclusions you have to take into account in your territories. The third thing is for you to share positive commitment actions to be taken by public authorities in order to improve the inclusiveness of your practices in an exchange with participants. You can also share on the importance of being inclusive and the perception of a democratic process as something positive that would involve the community. So how we perceive democracy as an important part of our process. So I'm going to go by the list I have here, which starts with Ando Tanya, who is a researcher and professor at the University of Côte d'Ivoire. Then Laure Donwai.
Maire de Mayo, ici encore.
She is the mayor of Mayo in Côte d'Ivoire, and Annabelle will be replaced by the coordinator of participative project of the city of Grenoble in France. And the last panelist will be Mr. Jean-Jacques Yapo from UVCOC, the Association of Food Staff Producers in Côte d'Ivoire. I will keep the time and let you know when you have 2 minutes left so that you cover everything. It is an honor for me to be here. I'm here as a sociologist. For me, I want to emphasize on the sociological realities in the city of Abidjan regarding this pandemic. I will go straight to the point and say that whenever we have a pandemic in an environment, the population will develop a specific perception of the pandemic, and that is what will lead them to adopt specific behaviors. What we observed is that depending on the time and the place, populations have developed different strategies to fight against the pandemic. Since the outbreak of the pandemic in Côte d'Ivoire, we shifted from a general panic to a sort of acceptance of the pandemic. And depending on the neighborhood, we noticed that these social distancing measures are not applied. We have investigated 3 areas. We have investigated the Félix Houphouët-Boigny University, where I usually work, because measures were implemented there in the first place, social distancing and hand sanitizing. The university is supposed to be a place of knowledge, so we can assume that these measures normally will be fully respected by the professors and students. The second place investigated was the market of vegetables, where we noticed that the measures were not fully respected. The third place was a poor neighborhood called the Mosikro, where the measures were not respected. So in those different places, we had the same behaviors, non-respect of the measures. These measures were taken, in addition to broader measures like closing of schools, biomedical measures like hand sanitizing, hand washing, wearing of face masks. But there are also other measures that were taken by the populations. Among these measures, we have the neem leaves, consumption of neem leaves, wearing face masks on the chin, like I'm doing, because people wear those masks mainly because they know that they will be prevented from having access to some places. Now, what are the perceptions that were developed by these different social categories? The first perception is that there is people tend to ignore the existence of the virus. Some will believe that it is a virus that was created by the Chinese. Some also see it as something which looks like the usual flu, and others will see it as something invented in order to have access to their financial support. And it is also believed that there is no contamination possibility. Another belief is that it doesn't affect Africans. It doesn't affect poor people. So what we notice is that, well, since it has come in Côte d'Ivoire, the cases identified were in rich neighborhoods. That is how these beliefs were created. So the disease was seen as a disease for rich people, a disease for rich countries, a disease seen as a means for Europeans to dominate and to rule over Africa. It is also perceived as a disease that doesn't resist hot weather, and even in the university area, there's a center that was created in the university. But what we notice is that even there is no, people do not go in those, in that center. So these are some elements that I wanted to share in the first place. Maybe with the questions, I will elaborate. You have gone very fast. So thank you. Madam, good morning to everyone.
I'm going to make a presentation removing my mask. My name is Senator of Anawa and Mayor of Mayo. Mayo is in the southwestern part of Côte d'Ivoire, an agricultural area of. It is located 380 kilometers away from Abidjan, and it has 240 square kilometers and 30,000 inhabitants. We know that Côte d'Ivoire was hit by the pandemic like every country. What have we done in Mayo and to contain that epidemic? There was no COVID case. We have done a lot of awareness raising on the radio, on TV, to the various community. It was not easy to wear the mask and to abide by. We know that in our country, funeral is important. How to make understand to our country that they shouldn't, let's say, they have to break funerals. And we managed to contain that epidemic, and we observe what impact it had in our community. Less taxes because Abidjan was locked down, and traders could not get the commodities. In terms of social and cohesion, it was less, and there was no more soccer and the matches, and everything was cancelled, and we have to contain the link, and we develop the digital is the solution that was the population adapted to get that number. We are in a rural area. It has not always been easy. What was positive with COVID, the municipality and centralized and decentralized bodies work, and we discussed in the region to see how we can handle this epidemic locally. When we think about inclusive city, and to me, I find it hard to accept that concept, which means that the entire population must have access to, let's say, to employment or social housing, and not differentiate between the various, let's say, segment of the population. But we know that Mayo is a small municipality. If the government does not assume its responsibility, will not be able to develop the community. This is what I want to say. I will give the floor to. I'll give you back the floor. Okay.
C'est ça. On va faire comme ça. Relax. Tu as parlé dans toutes les conférences avant. À vous, c'est bien pour vous? Est-ce que
Bon, il n'y a pas de problème. Non. Il n'y a pas de problème.
Ok.
Alors, je ne vais pas peut-être revenir. Je suis Yapo. My name is Yapo Jean-Jacques, the Director General of Uni COVID. I'm not going to go over again what have been said by my predecessors. I would like to recall that inclusiveness is not only a political concept, but this policy should be participative. I would like to speak on what the mayor said. She said that Mayo being a small town, there cannot be inclusive. In the current state of affairs, it can be true, but I would like to say that there is a policy which is implemented by the local authority. So in terms of director of, let's say, apex body, we want to enable everyone, whether small or large, to take the floor and to express themselves and have access to all services delivered by our apex body. So this inclusiveness, we are fighting hard for all of them, whether small or large or average. We have three types. You have large towns, medium town, and the very small one. In our opinion, a mayor office is a mayor office. So each mayor is elected by local population. You don't have what you call, let's say, a big mayor or a small mayor. So the same applies to our territory. All populations are equal, whether they are blind, disabled, widower, fatherless, or disinherited, vulnerable, whether male or female, all are equal and should be treated the same. If some basic services should be given to any segment of the population, they have to benefit by it undiscriminatively, and everything should be done, let's say, fairly, and all should have access to the same services at the same place, territory-wise, provided by the same authorities. Today, the issue pertaining to the environmental management based on SDGs calls for inclusiveness. The issues, and let's say the example of SDG 11, contributions should not come from a single segment of the population only, the wealthy one, not only from women, not only from men, but from all the segments of the population living in the territory, so that every sensitivities be considered and addressed, every problem will be addressed the best way. Knowing that, let's say, town planning is increasing, it's creating some problem relating to employment. If it is not handled in a fair manner, we will always run into problems. And today, with the let's say citizenship, citizen-oriented participation, and we can put it forward in our territory. That can help us to address the issue of inclusiveness nationwide, and to be able to bring all the population to enjoy the services being delivered. So I rest my case. Thank you. As a moderator, you make my life easier because you always stick to time. Thank you. Indeed, it is not yet over. You will have to stop me from talking because I'm talkative. Okay, you were talking about others. Okay. Well, I am from the city of Grenoble, and I am the director for Democracy Local, and I have a Breton accent, so my mayor is going to France, and I'm still staying to the end. And he has an ambassador with the ambassador of Senna, with the mayor of Cocody. So I would like to, let's say, take the speech that he prepared. I'm going to be his voice. I'm going to try the questions on inclusiveness. I read because she's the writer and speaking through me. And since March 2020, we have experienced a special status, whereas democracy was weakened before COVID-19. COVID-19 has widened the gap between citizens. So here, like as in France, the management of the crisis was vertical. Decision was from the top to the bottom. So the condition of the crisis should not be, let's say, a denial of democratic and citizen participation. This is a situation in which everyone should play its part. As the crisis of confidence is arising among citizens, is important for us to, let's say, operate locally, regionally, for fear or widening the gap between, and also create a sense of, let's say, lack of confidence vis-à-vis the government. Hence, the mistrust among the population toward official speech, official rhetorics, and also decisions. During this period, it was more than necessary not to let's say, remove the participatory action, and it is working well. That is why, regardless of the crisis, health crisis, and successive lockdowns, we managed to maintain the participatory budgets, which was ongoing in the year, and since the onset of the health crisis. At the time of the first lockdown, we have to make adjustments in order to take into account the population. We created what we call online engagement, during which people can discuss about projects and their initiatives. However, some exclusion emerged, and this is what we call the digital divide. And not everyone in Grenoble has access to internet or to a computer or to internet connection. And in order to address this exclusion, which appeared very quickly, there was a need to create, let's say, some physical shelter, and to give access to those who would like to travel, to also participate with others. So I'm not going to dwell on that. We can discuss about that later on. So, and we have also launched another 18th project of participatory budget, and it's going to be voted in July 2022. And I said it in the various panel. The participatory budget is open to every dweller, regardless of his citizenship, starting from 16 of age, and it has to be institutional and representative. This is done by citizens which are formally recognized by the governments. So I'm still carrying on. It is transforming the life of the city thanks to ecological or solidarity project proposed by the INAMID. I'm not going to dwell on this budget. We spoke about that at length this morning. We have another system that we sought to develop because not everyone will take part in the budget because it is quite lengthy and it is painful and you have to speak in public. So that is why we developed two people in the most living in most popular neighborhoods, what we will call republic, let's say, projects. We mobilize municipal or city officers and to come closer to local dwellers. These are premises and spearheaded by local dwellers, and they are supported by city officers for them to build with us their amenities. So we do it together. We build together. This is a contributive and democracy approach. And not only we do that, but we share our knowledge, our skills, and know-how. In order to go far in terms of social inclusiveness as part of participation, and you will see why I go over this question again, we have developed project workshops. This is a system for citizens in which, and let's say some citizens which are, let's say, drawn by lots, and for them to make contributions, and we support them. We were able to implement 3 projects, including one the fight against isolation of elderly people who are living in dire poverty. And I'm talking about this type of workshop because inclusiveness has to do with the giving the possibility to give. So okay, I knew that I would be talking plenty, so to come and take part in the public discussion. This is a way of promoting people who will not come willingly and to, let's say, be part of citizen participation. And during this quasi situation, it was necessary and to get involved the citizen in the management of the health crisis, and therefore to create, let's say, democratic revival regardless of the impossibility to meet. And in France, like in other, we were locked down for many months. So however, using the loopholes of the law, there were some passes and there were some meetings to handle the crisis, and we created a convention on the telephones and with the criteria and societal one, enabling us to grow, to cover the various parts of society as part of parity system, 50% women, 50% men. And meetings were held once per month between November and now, and April, to get them involved in the management of the health crisis and supported by local experts. And I don't want to go any further on this matter, but we would just want to say that the health crisis disclosed, let's say, holes in and the racketing that we had, and we need to rethink about that and to see how to become more inclusive beyond the crisis. We need to think out of the box. Thank you.
C'était parfait, je n'étais pas coupé. Je t'ai donné un avis.
I was not stopping you, but it's a good thing that you kept in the time. So maybe what we should do now is to give the audience the opportunity to share their perception of this topic, their understanding. So I don't know if someone in the audience has anything to say, any question or something to share with us. Your perception as citizens. You don't need to be expert in your respective cities. You have experienced these situations. There's a very interesting speech by an Italian politician who said that we have accepted the top-down in the emerging situation, but now that it's about a reconstruction, we do not want to use the same means. So how is this transition? How did you perceive it? What are your questions to the researchers, to the mayors? Well, one over there. You have to use the microphone for the interpreters. Good morning to everyone. Thank you to the panelists. My name is Bibli Boris, student in laws. Before asking my first question, I would like to know what we call city. What is a city? This is a question to now the question to the DG of UVCOC. Since in our administrative organization we do not have cities as territorial administration, what is a city? What is the difference between a municipality and a city, a town? Still a question to the DG of UVCOC. Before COVID-19, what was your perception of inclusivity in the various territorial entities? What were your observations and what actions were taken by UVCOC to solve the issues related to integration? Well, another question over here. I am Mr. Danlou. I'm the mayor of Grand Zatri, not far from Mayo. COVID-19 has surprised the whole country, including us as mayors in charge of the municipalities, to such an extent that we who mostly depend on the national budget, we were confronted to difficulties in receiving our financial subsidies. Besides this, the mayors couldn't even move easily to from one point to another point. To move from Abidjan to your municipality, you needed to have an authorization, which made it very difficult at some point to move and to go in our municipalities. But anyway, we managed. Only when the only moment when we could move easily was when the government would travel in our municipalities. would we receive the necessary equipment for the populations. That is the only moment when we could move easily. And on these occasions, we are expected to identify those who have a right, or those who are eligible to receiving these equipment. And most of the time, these people are the most vulnerable. Those who couldn't move, those who were disabled. These are the categories of people that we distributed this equipment to before giving them to the general populations. As mayors, it was all the time a sort of a race, because we had to use our own money to assist the populations with those equipment, protective equipment. We have this is how we have contributed to protecting our populations who were not able to manage by themselves. This is what I wanted to say. Thank you. Anybody else? Yes, over there. Good morning to everyone. My question is to the mayor of Mayo, who spoke about the competence of the municipalities under the supervision of the central authority. She sounded pessimistic on the inclusive city concept. My question is to know if full autonomy of the municipality is a necessary condition for the establishment of inclusive cities. I am Mr. Koulibaly from Cool Corporate. I want to take the specific case of the city of Mayo, so that is a question to the mayor of Mayo. My question will rather be contributive. We noticed that there is something specific with Mayo, and what has been a success in Mayo can also be a success in other cities. So I would like the mayor to share with us how she has been able to achieve what she has achieved in Mayo, turning it into a special case. I want to add one thing. There were many questions on multi-level governance, which was one of the major issues during this crisis. In multi-level governance, there are agreement and disagreement. Sometimes there's tension between the central government and the local communities. I think about saying this, I'm thinking about places like Brazil, where there was a lot of struggle, but everything is for the welfare of the citizens. Now, in times of disagreement, what are the resources? What did the citizens represent for you to support your action in this, let's say, confrontation with the state? So, Madam, maybe I should start with you. No, sir. Yeah, all this is about citizen participation. Thank you for your question. As a matter of fact, the previous under the previous regime, we had 5 levels of administrative or territorial organization where we had municipalities. Now, make a difference between municipality and city. That was the question. Well, it's not something that we can do, but if I want to get into more specific definitions of services and the size of population or other aspect, yes, based on this we can identify make a difference between the city and the municipality. But I don't need to get there because definitions are easy to find. Yet I want to rather focus on the second question: what was done by the municipality before the outbreak of the pandemic, and what was done before and after. The inclusivity is a new topic for us, the same as participation. For us in Cote d'Ivoire, these are new notions because our decentralization is very recent. We actively began it maybe in 1985, because that is when we created multiple municipalities, and then 2001. Today we have 201 municipalities. So in 2018, 4 new municipalities were created. I'm saying this to explain that our decentralization is very recent. Like the mayor of Mayo said it, she's not denying her responsibility, but there's a part of that responsibility which belongs to the state, because if part of our territory should be held as an exclusivity, the human being is normally part of the strategy implemented by the administration, but this can be done only if the authorities have the means to address the issues facing the populations, or issues related to environment of management of the environment are very big issues. Management of waste is also a big issue. If we should integrate participative management to the management of local territories, it goes with some financial aspect. Like, let's say the example of waste, household waste. Today we have ANASHED, which is an entity created by the government, and that is in charge of managing tax generated by the management of household waste. ANASHED is not present everywhere in Cote d'Ivoire, while the issue of waste management is a crucial one in Cote d'Ivoire. Whatever the commitment of the populations, if we do not have the required financial support, then nothing can be done. If the government could equip all the municipalities with dumping facilities and treatment, waste treatment facilities, then the effort made by the population would prove useful and efficient. That is why she said that the government should play its role. You know, today no decentralized authority can implement a local policy without taking into account the expectations of the populations. So exclusivity was existing before the outbreak of the pandemic. It became more severe due to the financial difficulties and also due to all the prejudice that was expressed by the populations. You know, since the outbreak of the pandemic, there are some people who have not come to Abidjan anymore because they think that Abidjan is where the pandemic is being disseminated from in all the country. Some say that they are afraid of rich neighborhoods because of that perception, whereas poor neighborhoods also have a part in the spread of the disease. So the outbreak of the pandemic has intensified the issues that were existing before. So in the participative democracy, the contribution of the communities is taken into account so that we can respond to the needs of the populations and avoid discriminating against the populations, but take them into account whatever their background specificities. I was talking about waste management, but the same could apply to jobs and also to many other aspects where all the communities have to be involved. I don't know if that answers to your question. So to summarize, I will say that there was an existing situation. The pandemic came to make it to worsen the situation. Today, it is important to have a local response that could only come from a contribution of all the communities to the identification of the most relevant solutions. Thank you, Mr. Yapo. You know, for inclusive city, you know, I have doubts. I said I have doubt about implementing inclusive city, but I also have hope. What I mean is that inclusive city has to involve communities. You know, Mayo is not an inclusive municipality, an inclusive city, because, you know, there are infrastructures that have not yet been implemented by the state. And, you know, inclusive city is also about having the community involved. All the components of the society have to be integrated to the city management, participative or not. These are new mentalities to develop. In the past, we used to have the mayor on one side and the inhabitants on the other side without any communication. But today in Mayo, what we do is to interact with the communities to establish participative budget that are prepared based on interaction with the populations. You know, I've been elected by the populations, but I'm working based on their needs. Therefore, what we do is to identify these needs. You know, the health aspect is not my responsibility, because there are healthcare facilities that have to be implemented by the government. Currently, the populations have to walk long distances to have access to those medical services. That is the reason. These are reasons why I'm saying that inclusive city is not yet a reality in Mayo. You know, what's happening in Grenoble is not what's happening in Mayo. We need to take into account our realities. We know how our communities operate, and we, based on this, we have to think about how to build inclusive cities based on these realities. Now, what is the secret in Mayo? Our secret is the human factor. We need to have them integrated. What do I bring? Each citizen has to think what he can bring to the community, what he can bring to the city. You know, everywhere, everything is supposed to be the responsibility of the mayor, waste or other things. If you see the recent census of the population of Côte d'Ivoire, Mayo has been penalized. We have 30 inhabitants, but the census has identified only 9,000 inhabitants, which is a real injustice. I think the Ivorians have to wake up, because these are your municipalities, so it is for you to get involved for your own development. We do not necessarily have all the competence. The government, the state is there to assist us, but you as citizens, what are you doing? Because it is our living area, and we have to take care of it together as members of the communities. Otherwise, we cannot make it. There's also a necessity to change mentalities. We have recently issued a decree that is going to be presented to the populations, you know, for the environment, how to take care of the environment. So we are all concerned by this. It's not only about having a mayor and sitting back. You know, all the mayors, you know, we are competing among ourselves, but our municipalities have to be in good conditions. If an economic operator wants, for example, to invest in Mayo and he doesn't find suitable, good conditions, well, of course, he will leave and go to Subre, for example, which is next to Mayo. You know, it is important to take everything into account. If I don't have the necessary infrastructure, nothing can be done in terms of inclusive city. So we don't have any secret. It is a strategy in which we put the human factor in the heart. Monday, you have 5 minutes because we have to go for lunch. That is the information I have just received. If we want to find food, we should finish by 5 minutes. When the pandemic came, a global decision was taken by the WHO about different measures to be applied in all countries on all continents. But you know, the specificities of each country and each continent has not been taken into account in the implementation of those measures. You know, in Africa, for example, we are used to hugging. So these aspects of our culture were important to take into account. So I think the social distancing measures, for example, shouldn't have been implemented without taking into account those specific features of our communities. When some cases of COVID were detected in some countries, people believed that these infections were caused by the rich neighborhoods who went in the poor neighborhoods. Sometimes when you go in some places, you would just remove your face mask. Another reality is that even at university, the vaccination center has been created at the university, but not many people are going there. So, and that is the situation up to now. So, my point is that the measures cannot be applied in all neighborhoods, in all communities, the same way. We should also take into account the local strategies, the strategies that can be adapted to each community. Because we are living in a society, you know, as sociologists, we say that, you know, sociology is the science of social relationship. So it is not possible to take these relations into account when trying to implement those measures. I will not be long. I think I have only 1 minute. I have two things to say. One thing is Giovanni raised the question. How did you take the citizens as a resource in the conflict with the central administration? Some markets were closed. I mean, in Grenoble, for example, we decided not to close the market, while the central government had decided that these markets should be closed. There were very strict measures that were taken in order to have access to the market. You know, after the lockdown, when we came out again, the question was to know if we would apply strict or strong measures for people to have access to marketplaces. You know, in this situation, the citizens played a very important role in the final decision that was taken. So this is the answer I can give. There are two levels in how the citizens can play a role in the orientation that will be taken by the administration. The second thing I will say is that this was an opportunity. This pandemic has been an opportunity for us to show more solidarity. We have created a website and an initiative that has improved the collaboration among citizens. This is it. Well, I think we can now go for lunch. I say thank you to the panelists and to all the participants. Thank you for sharing your concerns and input. It took us 1 hour, but it was very good. Thank you.